So, uh, Good evening, everyone. My name is Dr. J Lakhani. I am a consultant endocrinologist at Zydus Hospital in Ahmedabad. And I'd like to really thank IMA Dombivali, especially Dr. Gayatri, for having me for this talk. I'm going to talk on my favorite topic, that's the use of newer technology in management of diabetes mellitus. Now, what we're going to do is, in this, we are going to divide the presentation into two parts. We are going to talk about newer technology for diabetes patients available in the market. And secondly, we are going to talk about newer technology, mainly apps that we are developing for doctors to help them manage diabetes. Let's talk about some newer technology for diabetes mellitus, which is available worldwide. Some of these things are available in India. I'll tell you what is available in India. I'll tell you what's not available in India also. So I think a very, very important form of diabetes technology, especially for patients with type 1 diabetes, is a closed loop insulin pump. So what is a closed loop insulin pump? So you have two segments of the pump. You have a continuous glucose sensor, which obviously continuously monitors the glucose level. And this sends the data to the pump. And based on the data from the continuous glucose reader, the pump decides the dose of insulin and adjusts the dose of insulin. Now, there are several generations of a closed loop insulin pump. There are actually 6 levels of closed loop insulin pump which are there worldwide. The early ones are more or less outdated, but what we have right now is a second generation of closed loop insulin pump available in India. It's called the 780G from Medtronic. This is an automated basal hybrid closed loop device, right? So what this is basically when it continuously monitors the blood sugar, as you saw from here. So it continuously monitors the glucose using the sensor, and it sends the data to the pump, and based on the glucose reading, it can adjust the dose of basal insulin. So for example, if the patient's blood sugar goes high, then it automatically increases the dose of basal insulin, and if it goes low, it automatically reduces the dose of the basal insulin. So this is a hybrid closed loop device which is available in India. It is extremely useful for patients with type 1 diabetes. I think the next generation of a second generation closed loop device would be a fully automated closed loop device, where actually you can also have mealtime data, and the bolus also can be automatically calculated and delivered by the pump. So this is the next generation, which is going to come very soon. And then finally, the third generation is fully automated multi-hormonal closed loop device, which is not available in India, but there are trials done by it in the West. It's called an islet device, where they are using two different types of hormones. You have both insulin as well as glucagon being used, and it completes. It's exactly like an artificial pancreas. Now, coming to from pumps, there are other pumps which are available worldwide. You have the Omnipod 5, which is automated insulin delivery system. Here, the advantage of Omnipod, this is not available in India as yet. The advantage of Omnipod is that you can have two different segments. So one, you have a pod, and second, you have a controller, and it's a wireless system, so you don't have to require any kind of tubing for this to happen. And similarly, you have a T-Slim pump, which is a slim and light pump, which is also similar to that. It doesn't require a tubing. So these are some newer pumps. They're not available in India as yet, but they're available worldwide. Now in India, they are developing a pump from IISC. This is called Insuflow. It's an insulin pump under development in India. It's an affordable pump. So the challenges with the pumps are that it tends to be a little bit more costly, and this is a pump which is more affordable. So that is what they are developing, but still, of course, still far from being available in the market as yet. Now, like I said, pumps are very useful for patients. So this is our patient with type 1 diabetes. She's a young girl, about 14 years of age, and we had a hard time actually managing her diabetes. There were a lot of hypos and hypers. And we started to put the patient on a 780G pump, and you can see the blood sugars are almost flat, right? So you can see the data over here. The average blood sugar reading is about 155, right, which is close to bringing her HbA1c close to 7%. This is called a GMI, this is glucose management index, which is an approximation done from this. And you can see, I think the important parameter to see is the time in range, and anything above 70% is considered to be good. So you can see 80% of her readings are in range in the left side. So that means that she's doing very well, right? You can see that she's having zero hypoglycemia. She's having almost no hypoglycemia. So I think all these things point out to the fact that the patient is having a good glycemic control with the use of insulin pump. Of course, then you have CGM. CGMs keep getting better and better. So in the worldwide, internationally, you have Freestyle Libre 3. Of course, in India, I still have Libre 1. And then you have Eversense. So Eversense is basically a 6-month CGM, which is implantable CGM. So you can implant this device, and then for 6 months you don't have to worry about it, right? So it's a, it's again available, not available in India as yet, but this CGMs keep getting better. Now, what is available now in India, which is, very good from Abbott, is Abbott's original apps. These were not available in India earlier. So there are two apps from Abbott. One is Freestyle Libre Link. These apps are freely available. You can install the app, and then you can then wear the CGM and start recording the device from the app, right? And you have the Libre Link Up app. Libre Link Up app is for doctors or for parents of a patient who is probably on a Libre, or any close relative. So what you can do is you can actually monitor your patient using the Libre Link Up app, right? So the patient who is using the Libre Link, they send the permission to the person at Libre Link Up. So without putting the CGM, you can actually monitor somebody else's CGM values, right? So this is what a Libre Link and Libre Link Up generally do. Another very interesting technology comes from Bigfoot Technology. Bigfoot is a company which was made by parents of people with type 1 diabetes. And they have developed something called a smart pen cap. Now, what the smart pen cap does is, it's again a very interesting device. So instead of using your usual cap on the pen on your regular insulin, you don't have to require a special type of pen. On your existing insulin pen, you can put a cap on this, right? And what this cap does is it recommends the so you need to, it can connect with your CGM device, you can see here, and it can recommend how much dose of insulin to take, right? So this is a smart pen cap, which is from Bigfoot. It's a great idea, I think, and I hope that it comes in India soon. But a similar type of device which is going to come to India soon is called the InPen from Medtronic. So this is the InPen system, which is a smart insulin device. So here what you have to do is you have to replace the insulin, with the pen. I mean the regular pen with the, so you need to put the cartridge in the smart pen, and again it connects with the CGM, connects with your mobile app, and it can recommend the dose of insulin to take depending on the blood sugar level. So these are some of the technologies. I think, in my opinion, a very important, perhaps I'll tell you, a breakthrough technology, and hear me out in this. This is something which is completely a game changer. I feel it's very, very important. We have probably not estimated this. So this article was actually shared to me by Dr. S.V. Kulkarni from Mumbai. It's very interesting. I would suggest that you go and read this article. It's a very early prototype thinking, but there is great potential here. So this is called acoustic analysis and prediction of type 2 diabetes using smartphone recorded voice segments. So here what they did was, they took some volunteers. Interestingly, most of the volunteers were from India. So they took these volunteers, asked them to record some voice samples using their smartphone, and they analyzed these voice samples and then correlated the data with whether these patients have diabetes or they don't have diabetes. And they found that there are certain features in the voice which can predict the diagnosis of diabetes mellitus, or which can predict the blood sugar status of the patient, right? Very interesting, right? So basically, what they're doing is they're doing something called a voice biomarker. So they're actually using voice sample to make a diagnosis. Now this is so interesting because this is something which AI can do very well and machine learning tools can do very well, that they can actually go deeper and try to find connections which commonly our human brain may not be able to analyze or may not be able to understand. So what I feel is that in future, we are going to full circle. Remember, we always used to do clinical diagnostics. So you have a patient in front of you, and then you see the patient, and based on your clinical judgment or your auscultation skills, you make the diagnosis. Now what we're doing is we are depending more on lab reports, on imaging reports and all that. I think we are going to go back in the future again, where with all this type of biomarkers, clinically available biomarkers, without asking the patient to get any investigations done, you will be able to analyze the patient's voice, see the patient's face, look at the patient's skin color, all these things, and make a diagnosis based on these clinical parameters, probably just using maybe a smart glass. Now I don't know if you have seen this, but there is a Ray-Ban has developed along with Meta have developed a smart glasses which you can actually record videos with that. So these things are coming very soon, and I think in future, as a physician, you will be sitting in front of the patient, analyzing your patient through your smart glasses and making the diagnosis without asking for any kind of investigation. So this is, I think, a breakthrough, and I really hope that such things keep coming more in future. Now I'm going to show you some of the work which we are doing. So apart from being a doctor, endocrinologist, I am also a little bit of a developer. We have developed some of the apps. So some of the apps, some of the people might be aware, the apps we have developed earlier are Notes in Endocrinology app, which are there in the store, and we had developed a Centurion insulin app. There's a hypothyroidism in pregnancy app. So these are apps which we had developed earlier. Now what I'm going to show you is our current and future work in the field of diabetes management. These are again apps. Remember, what we are trying to show you here are mainly early prototypes. These are obviously they are wherever they are available, they are free of charge. So you can try it out. Also, if you have suggestions, please send them to me, and I'll be happy to take those suggestions from you. So one system we are trying to develop is called diabetology.co.in. Now, when you have a patient with diabetes in front of you, there are so many clinical parameters which you have, right? You have the patient's blood sugar values, you have the lipid profile, you have the creatinine, you have urine albumin creat ratio, you have the patient's liver profile, SGPT, SGOT, platelets, everything, right? Now, how do you, with all this data, remember, different data points will have different connotations in terms of the prescription that you generate. For example, what is the patient's cardiovascular risk? Should I give this patient statin? Should I give this patient aspirin? Right? These things are important issues that we need to grapple with. Right? Whether this patient should be given SGLT2, should we give this patient DPP4, metformin should be given or not? All these kinds of issues really come. And when the patient is in front of you, you don't have that much time to really analyze all these things quickly, right? So what we are trying to do is we are trying to develop a system called diabetology.co.in, which quickly analyzes all these data parameters for you and then suggests a treatment prescription based on the entire system, right? So we have already developed the first prototype. You can check it out on diabetology.co.in. You can click on the first prototype and you can have a look. Now it goes something like this. So when you first go in, it is going to show you this type of data where you have to enter all this data. So you have to enter the age of the patient, the all the data points that I showed you. So all these data points need to be entered into the system, right? Now we timed the system. It takes only 3 minutes to enter all the data, right? So if you see the entire thing, this is for person who is not experienced using the system. But if you're already experienced using the system, you just need to, it'll take about 1.5 minutes only, right? So you enter all these data points in the system. There are some data points which are mandatory. For example, creatinine, fasting blood sugar, and HbA1c are mandatory. This has to be entered, but other data points are optional. So other cases you may or may not be able to. So at the end of this, you get this kind of recommendation, right? So first question is, does the patient need insulin? Yes or no. Diabetic kidney disease status, it will tell you cardiovascular risk category. There are a lot of other things you'll see when you open this up. It'll tell you. We'll also do the FIB4 score calculations, everything. These things will care, and then it will start recommending the medications, right? Statin, metformin, whatever, right? And any medication it's suggesting, it will also tell you why this medication should be considered. So this is something we have developed. It's a labor of love. It's a experiment. It's still we are developing this, but I think we have reached something which is quite remarkable in this space, right? And then after that, you can go to the prescription page where you can do the modification. You can add the brand name of the drug, maybe modify the dose of the drug depending on your requirement, and it'll give you the final prescription like this. You can then add more medicines to it, right? You can add more medicines, whatever you like, and finally it will generate the entire prescription, right? So this is what it looks like. You can download this prescription like a PDF, right? You can in fact change the language also from English to any other language, Gujarati, Marathi, whatever. You can change it depending on your need, right? So this is diabetology.co.in. Of course, the prescription generation part, this is there on our backend. We have still not uploaded it, but the initial part, this part, and the treatment part and everything, the initial prescription, raw prescription part, it's already we already put this up, so you can try it out for yourself. And again, like I said, you do give me feedback. Second thing we are developing, which is now in a more mature stage, is Endo AI. It's called endoai.co.in. You can again visit this website and you can find the link there. And you of course need to register for Endo AI, so you can check this out, right? I'll show you the so it looks like this. So you click start here, and then when you click on start here, it will take you to the Endo AI page where you can log in and register, right? And when you log in, you need to go to start here again. Right. So here what it does is, Endo AI is basically like a chat GPT for endocrinologists, right? So you have this segment over here where you select the subtopic from where you want to ask questions. For example, let's say disease of bone and mineral metabolism. So you go there, right, and you ask questions, right? So what are the causes of osteoporosis in men, for example, right? So it will give you all the answers, tuck, 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 very quickly, right, like this. And then you can ask a follow-up question, right? How does hypogonadism contribute to osteoporosis in men, for example, right? So you can then get the answer, and you can the entire thing, you can save this as a chat, right? You can save this up, okay, and then you can share it with somebody, or you can probably save it for your own thing, right? Now, at the back end, we have used something called endotext.org. Endotext is the largest resource for endocrinologists worldwide. It's a freely available textbook written by some of the best authors in the world, started by Dr. Leslie DeGroot. You know, some of you may know that DeGroot textbook of endocrinology was, before he passed away, it was a very popular textbook in endocrinology. So what we are trying to say is that we are trying to develop a system which is extremely robust and which is evidence-based kind of answers it will give you, and you can in fact make a lot of diagnosis of patients also. In fact, you can try with some of multiple choice questions. You have this USMLE style MCQs. You can put it up, and I'm sure 9 out of 10 times it will give you the correct answer, right? It's very, very accurate and very useful also, right? So this is how you can use. So here in this case, you can see we have taken this MCQ, USMLE style MCQ, and with a single best answer, and we put this up, right, and it was able to give the diagnosis. Yes. Right. So we put this question, and you can see it will say it's normal and gap, right? So that's the answer. So it will give you the right answer, right? So this is Endo AI. Other things we are developing, a little pet peeve of sort of a pet project. It's called Report GPT. Now we all have annoying relatives of ours who keep sending us reports, which bunch of reports, so many pages of reports. Some of the tests are really meaningless, they don't mean anything, right? So this is something which I've been trying to develop for a while. It's one of the early things we are trying to develop, but of course we've not put this up so far on the web, but we'll be doing this soon if a lot of people have interest in this. So what we are trying to develop here is that you take the patient's report, it will analyze the report and send it. For example, let's see this, right? So you upload this report over here, right? And I have modified this in saying that I'm an endocrinologist, so I only need relevant tests to my field, right? So it will, in a few seconds, analyze the thing and generate the important tests which are from the endocrinologist perspective. You can see here what tests are required from my side. So there are a lot of garbage tests, which are not required and they have been done. But in this case, for example, you have the patient's testosterone report, you have the other reports which are there. So you can see that, it was able to generate the entire thing, right? And then very interestingly, it will also start giving you the analysis, right? So you can do the analysis over here, right? So, so it does a pretty good analysis also, right? So you can then send this directly to a patient saying that, this is the analysis and this is what you probably need to do. For example, let's say vitamin D is low, considering that you need vitamin D supplementation and so on, right? So, like I said, you have annoying relatives who said, please have a look at the report and tell me what it is. Well, instead of that, you can say that, why don't you go to my AI assistant and, upload the thing over there, and, it will be giving you the analysis from this, okay? Yeah, and finally, the last thing, again, something which one of the early developments, again, we still not put it up online. It's still at the back end, but it's something which could be useful, right? So it's an app for summarizing medical papers. So we are all, we get shared a lot of important research papers, and but who has the time to read all the papers in detail, right? So what you can do is we have this system called Saraswati, right? We named it after the goddess of knowledge, and so you upload the paper in the system, right? And then you can directly say, you can make a one-line summary of the paper, or you can have a 5 important bullet points, or you can have a section-wise summary. So in this case, we have uploaded this paper. Here you said, tell me the 5 key points from the paper, and here it will give you the 5 key points in bullet forms. You can say then, just give me one-line summary, and here it gives you the one-line summary. You can say, give me a section-wise summary. So it will generate the, there you go, develops the section-wise summary of the paper, right? In fact, then you can go and chat with the document also. You can ask questions to the document. So this is something we are developing independently. Now, a lot of you will say that ऐसे तो apps हमने देखे हैं, but having said that, we are trying to go one step further. What we are trying to add is now, so you need to give a audio sample of yours, and it will develop and download. You can generate the audio summary in your own voice. right? So then which you can share it with your patients or with your friends or with your other colleagues. So in your own voice. So you need to give a small 30-second audio sample, and once it starts, it analyzes your voice, and then it will start generating the summary in your own voice, which you can then download as a MP3 file, and you can share it with your friends or colleagues. You can also convert the article into PowerPoint presentations. So a lot of us, make a lot of PowerPoint presentations, give a lot of talks. So you can use this tool for doing that. Right? So these are some future additions to the same which you are trying to do. Finally, of course, lot of you might be following me on, we have a notes in endocrinology, which is a freely available notes system. It's available on endocrinology.co.in. You can visit that website. You can get all the notes, and you have very interesting notes on very interesting topics. A lot of these topics are not covered in textbooks and other textbooks. So again, we went one step further and actually wrote a book on this called The Best of Notes in Endocrinology. I'm happy to say this is now available on Amazon and available on Flipkart. So you can order this. It's called The Best of Notes in Endocrinology, first volume. We have about 9 notes here in this, which are varying from various topics, and one of the topics which would be very interesting to you would be artificial intelligence in medicine. So you can check this out and read it. I'm sure it's going to be very, very useful to you in your day-to-day life, right? And we are coming up with more volumes, so we are going to come up with about 3 or 4 volumes more of this, right? So it's going to come out soon, right? So again, thank you so much. Thank you for a patient listening. And if you have any questions or queries, you can send it by email to me on dromlakhani@gmail.com. I'll be happy to take them up. Thank you.